All right, let's talk about HEMLIBRA. If you or someone you care about is using this treatment, then this explainer is absolutely for you. We're going to walk through the most critical safety information together, step by step, so you can feel totally confident about using it safely.
So, here's our game plan. We'll kick things off with the basics, what HEMLIBRA is and what it does. Then, we'll dive deep into a really important warning about using it with other medicines. After that, we'll cover what to do if a bleed happens, how HEMLIBRA can affect your lab tests, and we'll wrap it all up with a little tool that is an absolute must-have, your patient alert card.
Okay, let's jump right in. First things first, what in the world is HEMLIBRA and who is it actually for? So, HEMLIBRA, which also goes by the name imisumab, is what scientists call a monoclonal antibody. But what you really need to know is its main job, routine prophylaxis. That's just a fancy way of saying it's a medicine you take on a regular schedule to help prevent bleeds from happening in the first place, or at least make them happen a lot less often. And it's for adults and kids with hemophilia A, even newborns.
Okay, so building on that, it's super important we get this next part right. We need to be crystal clear on what this medicine is designed to do, and, maybe even more importantly, what it is not designed to do. Getting this distinction is the key to using it safely.
And here it is, the big difference. HEMLIBRA is all about prevention. It's working in the background, day in and day out, to make bleeds less likely. It is not, and I really want to stress this, a treatment for a bleed that's already started. I heard a great way to think about it. HEMLIBRA is like your seatbelt, not your airbag. It's for prevention, not for the moment of crisis.
And that brings us to what is, without a doubt, the most critical part of this entire discussion. So please, really listen up here. We're about to talk about the serious warning regarding something called bypassing agents.
You see, the biggest safety concern with HEMLIBRA isn't really about the drug all by itself. It's all about how it interacts with some very specific medicines that are also used to treat hemophilia.
This isn't just us talking. This quote is pulled directly from the official patient guide, and it's pretty stark. It says that combining HEMLIBRA with a specific bypassing agent called APCC, also known as FEBA, has caused serious and yes, even life-threatening problems. So what exactly are we talking about?
The first major risk is a condition called thrombotic microangiopathy, or TMA. Basically what happens here is that tiny blood clots start to form in your smallest blood vessels. And these clots can block up the works, causing real damage to your organs, especially your kidneys.
And the second risk is thromboembolism. This is when larger blood clots form, and they can actually travel through your bloodstream and get stuck, blocking major blood vessels. This can be incredibly dangerous. So, to put it simply, mixing these treatments can make the blood clot way too much, leading to these very serious conditions.
Okay, so we've talked about the risk, which I know can sound pretty scary. But this isn't about being scared, it's about being prepared. Let's focus on the solution, having a clear, actionable plan for what to do if a breakthrough bleed happens.
And the plan is actually super easy to remember. It's just 3 steps. First, stop. You've got to stop taking any prophylactic bypassing agents the day before you start HEMLIBRA. Second, talk. This one is huge. You absolutely have to talk to your doctor and create a precise plan for breakthrough bleeds before you even start. You need to know exactly what to use and how much. And third, avoid APCC or FEBA. Seriously, you should not use it unless there are literally no other options. That conversation with your doctor, it's not a suggestion, it is 100% essential.
And in that extremely rare case where APCC absolutely has to be used, the plan gets even more strict. You need to burn this number into your brain, 100 units per kilogram. The total dose in any 24-hour period must not go over that amount. And that limit is there for one reason and one reason only, to minimize the risk of those serious side effects we just talked about.
All right, let's switch gears a bit and talk about another practical thing you need to be aware of, how this treatment can mess with some of your lab test results. This is another area where clear communication is everything.
This right here is the golden rule. It's simple. Before anyone, and I mean anyone, draws your blood for any reason, you have to let them know, hey, I'm taking HEMLIBRA. Why? Because it can interfere with certain tests and give back some really wonky, inaccurate results.
So you're probably wondering, okay, so how does it interfere? What's actually happening? Let's break it down and look at which tests are affected and, just as importantly, which ones are not.
So check this out. The main thing to know is that HEMLIBRA interferes with a lot of the common clotting tests, specifically the ones that rely on something called APTT. If a lab runs one of those tests, the result they get will be wrong. But here's the good news. There are other types of tests that work just fine and give a completely accurate picture. And that's exactly why you have to tell the lab staff you're on HEMLIBRA. It's so they can make sure to run the right test to find out what's really going on.
And finally, let's talk about a really simple but incredibly powerful tool that puts all of this crucial information right into your pocket. It's your safety information lifeline, the Patient Alert Card.
Okay, these are the rules, and they're pretty much non-negotiable. Your doctor or pharmacist should give you one. You've got to keep it with you at all times. And it's not just for your hematologist. You need to show this to anybody providing you with medical care. A new doctor, a dentist, an ER physician, anyone. Oh, and make sure your partner or caregiver knows about it too. And look at that last point. You need to keep carrying it for a full 6 months after your final dose because the medicine can stay in your system for that long.
So you see, this card is way more than just a piece of paper. It's your advocate. It speaks for you when you might not be able to, making sure any medical professional instantly understands the specifics of your treatment. It puts this critical information right where it needs to be, in your hand. So the final thought here is, how can you make carrying this card a seamless part of your daily routine?